This video is going to show you some ACL rehab exercises that are usually done in the first week post-surgery. So one of the most important exercises we can give to patients is a quadricep set. This is basically pushing the back of the knee into the towel and trying to get that knee as straight as possible. We need to get terminal knee extension as quickly as possible so patients can walk more effectively. Once we get good straightness of the knee, we can keep that contraction and take it into a straight leg raise and lift it in the air, holding it for a few seconds. Another idea for getting that knee extension is some hangs over the edge of the bed, so your thighs are over the edge of the bed, so just letting that knee hang nice and straight. You can use the other leg as a bit of a overpressure if it's tolerated. We can also work the other way, so working a bit on knee flexion mobility, so that's slowly bringing the heel towards the glutes and then taking them away in a nice, slow, controlled manner. Always important to double check with a consultant with more complex injuries to see how far the patient is allowed to take flexion in the earlier stages, because there might be some precautions on there. So there might be a certain amount of degrees that the consultant doesn't want to go after a number of weeks. In this position as well, we can go into a heel dig. So we're just having our knee slightly bent and we're digging the heel into the ground, switching on the hamstrings. Especially if there's been a hamstring graft, we want to start building up the strength around that area. Especially with patella tendon grafts, the kneecap, patella can get quite stiff. So it's important to do some patella mobilisations early on. We can grab the patella from the sides, taking it side to side, seeing that translation. Additionally, we can go up and down in different directions, making sure that we're getting a nice glide of that patella. To promote a bit of circulation through the lower limb, we can keep the legs elevated. That's going to disperse the swelling around the knee, around anything that's gone down the calf, so we can do some ankle pumps as well. To build confidence in the patient in weight bearing, doing some weight transfers, so gently moving body weight to the operated side, just building some confidence in weight bearing back up, because early weight bearing is recommended. And whilst we're in this position, to do some weight bearing calf raises that's targeting another muscle that crosses the back of the knee. So it's just good practice to work on other muscles, not just specifically the quadriceps, to promote some early activation in the earlier stages.